Testing. Where he was responsible for polio eradication activities and the expanded program on immunization. He continued this work as the immunization team leader with WHO Angola and then as the WHO representative in Guinea-Bissau and Ghana. Prior to joining the WHO, Dr. Daniel was chief of the Division of Respiratory Disease at Health Canada. Dr. Daniel is a medical doctor specialized in internal medicine and infectious diseases. He holds a master's degree in epidemiology from the London School of Hygiene and Tropical Medicine and is a fellow of the Royal College of Physicians and Surgeons of Canada. Ladies and gentlemen, please join me in welcoming Dr. Daniel to the session. Please, Dr. Daniel, please join me here. However, before I give the floor to Dr. Daniel, since we will have some time, I would like to briefly introduce the topic of this presentation to you. And can I just have the first น้องคะพี่ขอไอ้ first slide ของพี่ก่อนได้ไหมคะ I just would like to briefly introduce the topic of this presentation to you. อ๋ออยู่ตรงนี้เหรอคะSorry, I will just briefly introduce my just little. Is มีไหมฮะที่หมอนุ้ยค่ะที่ส่งมาให้หมอนุ้ย
เซิร์ฟเวอร์ครับ
มีไหมคะ
ของห้อง 1.9 เช็คให้หน่อยครับ
Okay, if that is okay, I will just
109 ครับ ครับ
ถ้าผมหมอนุ้ยไม่ได้เอามาให้ไม่เป็นไรหรอกค่ะ Okay, I will just mention briefly then. ไม่มี
เดี๋ยวผมไปเช็คให้ดู
Sorry for the technological, lapse on this part. Maybe. Okay, that's okay then. That's okay. Okay, this session they have given the global movement on healthcare reform, and as you know, the healthcare a global movement on healthcare system. As you know, the healthcare system is very broad term and covering vast area. Therefore, we will focus our presentation mainly on those initiatives aiming toward delivering safer and quality health care. And since the WHO is directing and coordinating authorities on international health within the United Nations system, is very concerned about delivering safe and quality health care. A lot of initiative has been undertaken to promote quality health care. And sorry that we don't have the slide, because we have showed you that our Director General, Dr. Margaret Chan, has put in the World Health Report of 2012. She has clearly stated that one of the greatest challenges today is about delivering safer and quality care in complex, pressurized, and fast-moving environment. In such environments, things can often go wrong. She also expressed that what good does it do to have a high proportion of babies delivered in health facilities if the quality of care is substandard or even dangerous? This is just reflect that we really need to ensure the quality of care, not only advocating for people coming forward to the health facilities. And probably you already know about the burden of unsafe and poor quality of care, because evidence has revealed that 1 in 10 hospital admissions are associated with adverse events. For at least 50% are preventable, and 15.5 in 100 patients in developing countries are associated with endemic healthcare associated infections. And moreover, at least 43 million injuries each year occur due to poor quality and unsafe medical care. This evidence already show that service that unsafe and of low quality lead to diminished health outcome and harm. The WHO has organized an expert group meeting in 2016 to determine global priority for future actions for patient safety by the WHO and countries. And these include counterfeit and substandard drugs, problem with communication and coordination, latent organizational failures, inadequate competence, training and skill of healthcare provider, poor safety and quality culture, lack of human factors and design, misdiagnosis, maternal and newborn health care, unsafe injection and blood practice. And in dealing with unsafe care issues, we need to consider system approach rather than blaming an individual. We need to focus on the health system improvement as adverse events, because the problem of patient safety are primarily due to system failure rather than individual. Although human error does have a role, but it's only part of the problem of lapse of patient safety. Moreover, we need to learn from the problem to prevent its occurrence in the future. We need to learn from the mistake so that we can minimize the risk in the future. And I'm still thinking that I'm the WHO staff, even though I have been retired for quite some time. Sorry for that. Even though now I'm serving as a WHO consultant, still working for Myanmar. The WHO has put safety and quality of healthcare on the global agenda since 2002. The World Health Assembly adopted the resolutions on quality of care, patient safety, urging member states to pay the closest possible attention to the problem of patient safety, and requesting the WHO to support the efforts of member states to promote the culture of safety and quality within the healthcare organization. Since then, various initiatives have been taken at regional as well as country level to promote patient safety and quality of health care, including the establishment of Global Patient Safety Initiative, and you probably will hear from Daniel about it, and including adoption of several World Health Assembly resolutions, as well as several of regional committee resolutions to promote patient safety and quality of health care. Closer to home, I think that probably I just would like to show you, this is a recent initiative has been taken by Thailand as a follow-up to a resolution that has been adopted in 2015 by the WHO Regional Committee on the patient safety, contributing to sustainable universal health coverage. HAI has been entrusted with the responsibility to be a focal point to carry out a country self-assessment on patient safety situation in Thailand, to identify priority area that requiring attention. Although we are doing quite well in several areas, but there's still some area requiring special attention. And this self-assessment has been carried out during June to September last year, 2016, with involvement of various experts, with the Ministry of Public Health, the professional councils, and the health. I think that I have to say the name in English. The National Health Security Office, National Health Commission, with all those involvement, and we have critically review this outcome together, and afterward on September, I think 16th September last year, His Excellency Clinical Professor Emeritus Dr. Priyasakul Sathyathorn, the Minister of Public Health, has officially declared a national policy on personnel and patient safety, to peace safety, to give a clear direction to move forward patient and personal safety in this direction. And I'm pleased to know that Thailand probably is the only country that has really looking at both personnel as well as patient safety. And we have a commitment from 15 organizations to sign a MOU to join hand and decided to move toward to translate this policy, national 2P policy into action. And now there's some effort to formulate a national strategy plan, national strategy to translate this policy into action. So this is a recent development in Thailand. And Dr. Daniel, I feel that Thailand will benefit from other countries' experience. So we would like to hear more about the global and regional initiative, what other countries has been doing in trying to strengthen the health system or that the response in order to promote the quality and safety of the health care. So maybe you can shed some light to us so that we can learn from what has been doing and something that we can bring take home and learn from them and move forward with our agenda. So you have the floor, please. Yes, please.
Anybody want some flowers? So sorry.
Oh, it's here. Maybe I need to. Can you do it? You can tell me. I can. Can you do it? Otherwise, I move it for you. Want me to move? Then you say next. I do it. Yeah. Yeah.
Can everybody hear me in the room? Really? Okay. Does everybody speak English? Sawadee is the only word of Thai. This is now working.
They have the translator there that they do the simultaneous interpretation.
Okay, that's wonderful.
Okay. Can you do it now, or you still need me?
I've got it.
Okay,
Yeah,
all
thanks,
right.
it's working. Thank you. Let me introduce myself again. My name is Daniel Curtis. I'm the WHO representative in Thailand. First, I need to tell you, Dr. Dwangvadi, thank you very much for your introduction. I know Dr. Dwangvadi is a former colleague at WHO, and it's an honor to meet you and an honor to be with you here at this session. I have to confess something to you. I'm not an expert in either patient safety or accreditation. My background is in infectious diseases and emergencies. Like was mentioned, I spent a lot of time in Sierra Leone during the Ebola outbreak. During that time, I learned a lot about patient safety. Of course, this was critical during the Ebola outbreak. But I would like to thank very much the HAI for inviting me to speak here. I hope what I have to say is a little bit interesting to you. I'm not sure I'll cover everything that Dr. Dwangvadi mentioned, but I hope that I'll at least be able to maybe provoke some interesting discussion. Some of you might be asking, why has WHO been invited to speak today? How many of you know the WHO or know well the WHO, how it works? You can stick up your hand if you know WHO. If you don't know WHO, that's great. Some of you know WHO, okay. Well, what I thought I'd do is I'd begin to talk a little bit about WHO and what it is that we do and what is our role in the area of patient safety. I'll talk a little bit about what WHO has done in this area. And then at the end of the presentation, I'll mention the Sustainable Development Goals, why they're important, and where patient safety fits into the Sustainable Development Goals. So this will be a little bit the outline of my presentation. Like I say, I'm going to present a little primer on patient safety. I'm not sure if all of you are experts in patient safety, but I'd like to talk a little bit about some of the basic concepts in patient safety before I move on to talking a little bit about some of the global initiatives. So first of all, who is who? Who is the WHO? What do we do? Simply put, the WHO is the United Nations agency that specializes in health, okay?